Have you ever wanted a more defined waist, a shape that turns heads, but maybe you were told this just isn't your body? You can't change it. Women have been trying to get a smaller waist for centuries. Literally, corsets date back to the 1500s. And today, there's a procedure that reshapes the waist from the inside without removing ribs, without major surgery, and you go home the same day. And if you want to go further, a fuller figure, a bigger booty, fuller breasts without implants, fat transfer can do all of that. Your own fat moved to where you want it. But what if you don't have enough fat to transfer? What do you do then? Stay with us because Dr. Johnny Franco is going to answer these questions, and the answers may be procedures that most patients don't even know exist. Dr. Franco, tell me about a patient who came to you just desperate for a more defined waist and hourglass shape and had already been told by another surgeon that there's nothing that could be done. And what did she or he look like when she walked in and what happened?
Yeah, that's actually a more common question than you would think, especially in this day and age of everyone on their weight loss journey or GLP medications or just eating right, as they would say. But no question, I think I've had a lot of obviously I do a lot of liposuction, fat transfers, BBLs, and so I've had a lot of patients coming in for a round two or second BBL. They've been turned down by a lot of surgeons because they said, "Hey, you don't have any more fat. There's nothing left to do." And they're like, I'm not looking for a bigger butt. I'm just looking for a better shape. And in the past, we did have to trim the weight. There's nothing really left to do. Rib repositioning has changed how you think about that. I, in the past, have told a lot of patients, this is your body frame. This is what you were born with. This is how you were built. This is just what it is. And that is changing really rapidly. No question, we've all heard of these mythical rib removals, and there is a few certain circumstances where that can happen, but it's not for the masses. It's definitely a bigger recovery. Rib repositioning has changed this. A procedure under an hour, go home the same day, rapid recovery, but able to give you up to 4 inches of shrinkage of your waist. That's a massive transformation in a very short period.
That is massive in a short period. I will just repeat that. Amazing. I'm excited to learn more. But first, let's share with our beauty seekers a little bit about you. Dr. Johnny Franco is a board certified plastic surgeon, clinical faculty at the University of Texas Dell Medical School, and the founder of Austin Plastic Surgeon, one of the most recognized body contouring practices in the country. He's known nationally as the BBL King. Coming up, he's going to tell us why rib remodeling is nothing like what most people imagine when they hear the words rib surgery, and what it actually takes to get that snatched waist result to last. Stay with us because if you want to enhance the results of a rib remodeling surgery even further, Dr. Franco is going to share how patients who want a fuller figure but do not have enough fat to transfer are getting an hourglass shape with no implants and no surgery. And it's just hitting the market. Dr. Franco, welcome to Beauty Seek.
Thanks for having me. This is super exciting. I think such a great topic. These are some of the questions we get all the time. People are excited about it. They just don't know where to go. They're not really sure what this is. It's almost this mythical treatment that you're unveiling.
Oh, yeah, totally. I was talking to my neighbor the other day and he was shocked. I'm excited to be here and thank you for welcoming me into your environment. Most people think the only way to get a smaller waist is to lose weight. On a scale of 1 to 10, how much can rib remodeling change the shape of the waist for patients?
Oh gosh, we're talking 7 or 8 for most patients.
Fantastic. And you mentioned 4 inches earlier. Was that ever possible with any procedure at all before?
It is when you think about overall body contouring, but when we talk about the very specific patients that are getting rib repositioning, if you think about it, this is our patients that are already super fit, that already have a good figure, just feel a little bit boxy, low BMI. So these are people who are really thin to begin with. So there's not really a weight loss option. They're in a good weight. It's about staying healthy, staying fit. So for those patients, there's no other option that's going to be able to give this type of transformation. In the past, those are the type of patients that we were sending away, which is frustrating because they work hard, they've taken care of their body, they've done all the things right, and then to still feel like they had no options, that's discouraging.
It is discouraging. And most patients hear the words ribs surgery and picture
Mhm.
something extreme, like a long recovery, ribs removed, weeks in bed. 1 to 10. How true is that narrative for you and your patients?
Oh gosh, I think that's about a one. People are really pleasantly surprised. It was funny. I was talking to a friend of mine, Dr. Alfredo Hoyas, and we were talking about these rib repositionings. He'll actually take a ultrasound image of the fracture because sometimes patients don't have enough discomfort after the procedure. They're like, "Did something really happen?" Because I really don't hurt. And when we think about moving these ribs, we're like, "Oh wow, this is like a broken rib or something. I'm going to be in so much pain." And we just have not seen that. And I'm sure we'll dive into it, but I think it has to do with some of the special instruments, some of the special techniques that we use for this procedure.
Let's go there because I think we patients hear rib remodeling. Well, what does remodeling even mean?
Yeah, so what's interesting is you can actually do this through a percutaneous or a tiny little incision, usually half a centimeter or less. Sometimes even with newer techniques, something that's as small as an injectable port size. That's how small we're talking about. Because the goal of it, if you can see my finger here, is that we're just cutting one cortex of the rib and then moving it into position. There's some new specialized saw. They're called ultrasonic or piezotomes saws. They're basically vibrating blades that are used at special frequencies that only cut bone and cartilage. The benefit of that is the safety. And so that way we're not hurting any muscles, any soft tissues, keeping you super safe with this. For anybody that's not familiar with this, if you've ever broken your arm, something, remember a cast saw. So you can cut the cast off, not cut the skin. Very, very, very similar concept. That's how you can be super safe, but super effective. Do such a tiny, tiny little incision. But the hard part and the part where we need your help is we freed up these bones, but now we're in a corset to split this. The more you shrink that corset over time, the smaller your waist. It also gives you a lot of control because let's say you don't want that overly extreme tiny waist. You can stop at a point and be, I love my figure and just mold it right there.
Wow, amazing. Okay, and I'm just going to point to my ribs. Are we talking the bottom rib, the middle
Yeah,
rib, two
so
ribs?
it started with the what we call the free floating ribs, 11 and 12. So the last two ribs down at the bottom because they're not attached to the cartilage. And like anything, the techniques have advanced. If you think about it, when it first got described in Russia, actually, the incisions were much larger. Like most things, incisions have gotten smaller. Results have gotten better. Recovery's gotten faster. So we're able to do it through a much smaller incision. We definitely do the bottom two ribs in most people, and often now do the 10th rib as well, which also helps improve the overall shape. So this is usually incision. If you're going from the back, usually about 7, 8 centimeters off your spine. So kind of right at that nice curvature of your back, which is ideal, right? Because if we're trying to bring that waist in, we want to be right at that point where that bone starts to come around the bend because the goal is to just move the overall waist. So you still have that nice round shape, but that super snatched round shape.
Okay, thank you for sharing how close it is to the spine. I did not understand that. Now I understand. Okay, fantastic.
Because you're moving and you're just pushing just the distal tip. And so when you push just on the tip, it all comes around together. So you're not pushing everything in, you're shrinking the waist.
Gotcha. Okay, now after the surgery, there's one practice that is essential to getting the hourglass figure. If that practice is not followed, how likely is it that an hourglass shape is achieved?
Ooh, one. I think this is one of the procedures where you have to help wearing the corset, splinting that into position, and actually shrinking it over time. Most of our patients will downsize a corset at least once or twice during their 3 month journey to be able to get that waist into the perfect spot.
Okay, so the practice is wearing a corset for 3 months.
hmm Yeah.
Full time?
I mean, we'll let you take it off the shower, but that's about it.
Really? Okay.
Mhm.
And
And,
okay,
and honestly, the more you wear it, the more comfortable. Because if you think about it, if you ever sprained your wrist, sprained your ankle, when you add that support, that bone's not moving, that soft tissue. So it actually splints it into position. Most patients, once they get into a good routine with it, it actually makes it more comfortable. People actually tend to recover a lot faster. They're able to do more because everything's splinted and supported really well. So they can get back into their life really quickly.
okay. I love that. So, part of the requirement to get the hourglass figure is surgery and then a corset for 3 months. And if they don't wear the corset, you're not getting that hourglass figure.
You're likely going to be back to where you started because your body's going to rebound. Your stuff, everything's going to shrink. So because we're not doing anything to support it, the weight, the corset is really guiding that bone into where we want it to heal.
Okay, amazing. And then do you recommend any particular kind of corset or?
Yeah, every surgeon has their own preferences. This is where I think it's super important to make sure that you talk to your plastic surgeon. They make sure that they fit it exactly right. I'll tell you, we actually got a handful of different ones because everybody's tall, short, medium, wide things. So things have to fit just perfect. Also, a word of caution because you don't want to just change things on your own. A lot of times, repositioning is done as a standalone procedure, but also often it can be done with liposuction, tummy tuck, other body contouring procedures. If you're wearing a corset, really need to talk to your plastic surgeon and let them guide you about when to put that corset, how tight, because it can affect the skin and healing of the other procedures. So there's a little bit of coordination. Got to follow the instructions to get the best result.
Oh, so I'm just not going out to Amazon and ordering a corset. But
Sometimes people do. I don't advise it.
do you fit them with the corset and kind of look at it
Mhm.
and say, no, that's not going to
Well,
work?
we do. We tighten it in the office. We make sure it fits. We have them come back periodically. So if we need to change it, tighten it, we can do that for them. 100%.
It actually sounds really beautiful.
It's interesting because I don't know there's a lot of procedures in aesthetics where we're able to kind of control the outcome over a period of time. Most of the time, we talk about our expectations, what we're hoping to achieve. You go to sleep, you hope that you wake up, and it turns out like that a couple of months later, and you don't really have any say. Some of our patients have really, really loved that they're a part of this journey, and they can help control the ultimate outcome for all
Exactly.
those control freaks out there.
Yes. Yeah. Yeah. That's totally me. Okay. You've consulted with a lot of patients then looking to get an hourglass figure. What is the one question you feel that they should be asking you during a consult that maybe many never think to ask?
One, I think people need to ask about the recovery because I think sometimes people aren't in it to win it. This is one where we try to be really, really upfront about people. If you don't wear the corset, if you don't have someone that's going to help you put it on, if you're not in a good spot where you can do this over the next couple of months, then don't waste your time and money because you're not going to get the results. You're going to be disappointed with that. I'll tell you the other thing that people are pleasantly surprised is how little pain or discomfort that they have after the procedure.
Amazing. And that's why you keep the pictures so you can show them the surgery really did happen.
Exactly. Because the incisions are so tiny. To them, it's a little mind-boggling how you can have an incision this tiny and get to all three ribs and create that type of transformation.
Could you talk about that just a little bit for at the beauty seeker level, my level? Because I had a broken wrist and I think of that big saw. So that's what I have in my mind. And that's clearly not what you're using.
Yeah, so it's actually a tiny, tiny little probe, and there's actually a couple different ones depending on some nuances. But it actually can go through a tiny little incision. There's even some that are almost look like a kind of little bit of fatter percutaneous needle that can have that same vibration, and then you're just scoring one edge of the bone and able to move it in. So you don't need much access, and because you're not hurting the muscle, you're not doing any of those things. I think that's why people recover so well. If you really think about it, the more that we can leave the soft tissue, leave all the things alone, the less, and it makes sense, right? The less destruction, less damage we do, the faster things recover. So it's doing more with less, which is an overall trend that you're seeing in aesthetics across the board.
Love that. Okay. I just thought so if you're carving a piece of the bone out, just tiny as it is, where does that go? Does it fall away in the body or?
No, and it's just kind of creating these little openings in the bone itself. Your body will absorb it, and so it's just kind of freeing those areas. There may be a little bit of kind of bone dust up, but your body will absorb that.
Okay, great to know. And now this sounds like there's not going to be much of a scar.
The incisions are half a centimeter at most. They tend to be really, really, really tiny. Sometimes they look like a little brown dot if you got some darker skin. If not, then it's hard to see in most people. I remember giving a presentation once. Somebody was asking me where the scar was. I couldn't find it on the picture. I'm sure it was there somewhere, but it's pretty amazing how well these heal.
Okay, so you wouldn't even need any kind of scar guard or laser to get rid of the scar. You just really don't have A scar.
Yeah, I mean, everybody heals a little different, so I'm not going to go that far to say that you don't shouldn't take care of your scars or do these things. I always think you should. It's easier to be proactive than not. But people are pleasantly and often very surprised how small the incisions are.
Yeah, this sounds, yeah, amazing. I've never heard of anything like it.
I do think when people are looking, they should ask somebody, how much experience they have doing the procedure. It's one of these things that I think when done right by someone who's experienced, I do think that people can get tremendous results. Obviously, the ribs overlie the lungs and other things, so you do want someone that's done a lot of these and has a really good understanding of that anatomy to be doing this procedure for you. So I think a super fair question. Hey, where did you train to do this procedure? How many have you guys done at your practice? Fair questions.
Okay. I talked to Dr. Manzanata,
Yeah.
who also
Mhm.
does it. Yeah, he trains.
Who's a world expert? Yep, 100%.
Okay. And he said, for the procedure that he trains in, there's been about 7,000. I think when we interviewed a couple weeks ago, it was growing to be more than that. What is a lot of surgeries, that practice point where, a
You know,
patient.
obviously he's at one end of the spectrum, and when he's talking about all the people who've trained or done procedure stuff, I think really for something like this, honestly, if somebody's done over 20, you're in a good spot. The learning curve is really short, but I don't know that you want to be patient one or patient zero. And so honestly, at 20, you'd be great. He's at an extreme end of the spectrum where I don't know most people are going to get to, but yeah.
Yeah, perfect. Okay, that's great to know. Okay. 20 would give you the experience roughly that you might
For
need.
sure.
Okay.
And especially when you're talking about most of these are board certified plastic surgeons. This is an expansion of the skills that they've done. Most of us did hand surgery, other things. So, if you use the same piece of tone for rhinoplasties, other procedures on the body. So again, it's the skills that we've already done, just refining them to a different bone.
And the only way you can do this surgery is with a piece of tone. Is that correct?
That's not necessarily true. Before the PCO people used other sauce. I think the PCO makes it safer. I think it makes it more predictable. I think it definitely makes it easier. So I'm not going to go as far as saying you absolutely have to use it. I do think it's revolutionized the procedure.
Okay. It does sound revolutionary. Beauty seekers, here's what you just learned. Rib remodeling is not rib removal. It is a minimally invasive procedure that reshapes the waist the same day, and you go home the same day. And the practice of wearing a corset is essential. The ribs heal at a new angle, and the corset is what holds the shape while they heal. Skip it, and you lose your future hourglass. Dr. Franco, we just talked about getting a more defined waist with rib remodeling, but a lot of beauty seekers want the full hourglass shape, the waist and the curves. If someone wanted to take that hourglass shape further, how would you enhance it?
Yeah, I think Brazilian butt lift has been one of the hottest procedures for years. There's honestly a myth that BBLs have fallen a little bit out of vogue or a little out of fashion. That's absolutely not true. I think our aesthetics have evolved and changed, which is true for a lot of procedures. But with so many people on their weight loss journeys, we've done so much more targeted fat transfer, a little bit of shaping, a little bit of filling. I'll tell you, one of the things that has made Brazilian butt lifts or BBL so popular is the total transformation that you're talking about. Because not only are you sculpting the butt and hips, but you're shaping the waist, the tummy, the back. That total transformation is what patients are looking for.
Exactly. And it's shocking because I'm interviewing surgeons now as being, kind of launching Beauty Seek. But really, a lot of my community, women like me who we talk about procedures, we still don't understand it. So I'm happy that we're going to be talking about this today.
And Brazil butt lift is a great one because I think a lot of people think about this as, your South Beach supermodel, your swim week, runway model. And that's not true. So many patients just want to look good in clothes. They want to look good in that dress. They've maybe lost a little bit of weight. They lost a lot of areas like their tummy like they wanted to, but maybe also lost their butt. And so you'd be surprised how many people have a little bit of fat transfer, a little bit of a booty that maybe came from somewhere else.
Really? Okay, good to know. Maybe my friends just aren't telling me about it.
Exactly.
Dr. Franco performs hundreds of BBLs every year and teaches the technique annually at the American Society of Aesthetic Plastic Surgeons. He is one of the surgeons who helped bring safety back to this procedure at a time when it had the highest death rate of any cosmetic surgery in the world. Patients were dying, and Dr. Franco was part of the group that figured out why and changed how it is done. Coming up, he's going to tell us what was actually killing people and what changed. And stay with us because he's also working with a company right now that is helping to enhance that hourglass shape with BBL, even if you don't have enough fat to transfer from one area of your body to another. This new technology is sure to surprise you.
And appreciate you talking about the BBL safety. And so, just for clarification, no question the Aesthetic Society worked really hard. They had a task force about BBL safety. The numbers are actually a little bit kind of confusing. Came from one study that showed this high rate. Just so people kind of understand, the majority of these unfortunate deaths came from a small area in the country. I think where some maybe not best practices were being done. I've been fortunate to learn from this task force and then be able to share that knowledge at our course that we teach at the Aesthetic Society. But the biggest misconception about BBLs and safety was that when fat transfer first started, there was this belief if you transferred fat into the muscle, more of that fat would remain. You'd keep more of the fat that was transferred, which was probably true because the muscle was so vascularized. But in the buttock, if you actually injected the muscle, you were around these large vessels and veins, and that fat was getting into the vessels. When we learned that, now we can use an ultrasound so we can see real time where the fat's being injected. So fat goes only into fat, and now it's become an extremely safe procedure that we can do in real time with visualizing our exact placement of that fat.
Between 2011 and 2016, surgeons worldwide reported 32 deaths from BBL procedures. At its peak, the death rate was estimated at 1 in every 3,000, the highest of any cosmetic surgery. How likely would you have been to recommend that surgery at that time?
If I only saw that stats, I mean, I would be a one. I was pretty involved with the Aesthetic Society. I wasn't the actual task force that did the cadaver dissections with this, but was super involved with the society. And so, I think those numbers are deceiving, and maybe a topic for a later date of how they actually came up with that. Two, it's become extremely, extremely safe now that we truly understand that fat goes into fat. We're staying out of the muscle. We're doing the fat into the regular fatty tissue, staying away from those blood vessels. But also too, when you look at it kind of geographically, a lot of those unfortunate events were done in a very small area of the United States, where I think people are being a little bit maybe too aggressive with some of their techniques. In general, it has become an extremely safe, reliable, predictable, and very transformative procedure.
Okay, that's great. So that might change my next question. I was going to ask you how much safer is a procedure now compared to what it was a decade ago, but what makes it safer now?
Oh, no question. I mean, I think there's a couple things that has made the BBL safer, and I'll talk also about what makes it safer. Is that one, we took for granted the simplicity of the buttock, and one of the things that this task force in the society did, and not just for BBLs, but butt enhancement overall, we oversimplified that our butt was just our butt, and it was just kind of there may be some muscles, there may be some fat in there, but it was just like to look good in shorts and a bikini bottom, but that was it. Now we realize there's really this whole network of connective tissue that keeps our butt together. Some of that overzealous connective tissue causes cellulite, which I think you're going to cover in another episode. You also have these different compartments of the fat throughout there, which I think is going to help when we talk about shape over size. And then we also learned about this muscle fascia that causes negative pressure underneath. So it wasn't like a 1 in a million shot into these vessels. It was these pressure gradients. And we learned as long as we never disrupted that fascial layer, that barrier, we were super safe above it. So how do we do that? Ultrasound. And these are basically things that you can connect to your iPhone, to your iPad, and in real time, I can see the muscle layers, the different fatty layers. I can see exactly where I'm injecting the fat. I can see it injected. I see where it's dispersing. Kind of super interesting that you can now buy these little handheld ultrasounds or Wi-Fi them right into your phone or iPad and see everything I'm doing real time. So I think the technology's changed. Our education and knowledge of the buttock anatomy has changed. I know this is long-winded, but I think it's super important and honestly mind-blowing how much more we understand about anatomy in this day and age.
It is mind blowing, right? And I just think of the butt, it's just the butt, but where you're placing the fat is hugely important.
And that's become even more important as we've really talked about back in the days. BBLs were how big could we make these, making these really, badunkadunks in the backside. Now it's really about that like Pilates peach, super fit, super fabulous. And by actually taking that anatomy, looking at those specific compartments of the buttock, we can actually create more of a shape. We understand what we can and can't do safely. We now realize there's so many more compartments to this: skin laxity, cellulite, and then volume is just one portion. Like anything, whether we're talking about lips, face, cheeks, just trying to overfill stuff typically doesn't get you the results you want.
Makes sense. It makes sense. And the demand is not fading, but the type of patient asking for it seems to have changed. So, 1 to 10, how much has Ozempic and the weight loss revolution changed who is coming to you for a BBL?
Oh, probably 8.7. It's been huge. And now so many of our mommy makeovers, so many of our tummy tucks involve some of that lipo fat transfer. Because if you think about it, now it's a fat distribution, rather than just getting rid of things, we're sculpting, we're shaping, because I tell all of our patients, they should really think about body balancing. How do we make the entire body just flow and balanced? And that's what's super sexy. That's what's attractive, because everything is proportionate. Everything flows together.
I can tell you, I've been hesitant because my friend, she got it back in the day on her belly, and her belly just does not look normal. It looks all kind of lumpy. And is that just skill, or have the tools changed, or theories, the philosophies?
I think all of the above. One, there is some skill level, but there's also some things we can't predict. I do think some of the technology that we use for liposuction, some of the newer tools out there, from energy devices, from some of the specialized cannulas, from some of the vibration and other baskets that we can use to smooth this out. I think all those things have come into play. So makes the results much more predictable, makes it much safer, makes it much easier on the body. I also think, just like we talked about with the ribs, I think we also understand better what it takes in recovery period: lymphatic massage, proper usage of the garments, and some of these things. We do some skin coaching and some other things as well to make sure people redrape nicely. So I think all of that together has evolved how we think about liposculpting.
Skin coaching.
Yeah, fancy way for saying we use this KT tape to really kind of put the skin where we want it. The idea behind that is, if you think about it, you're trying to set the skin where it wants. You've caused this injury underneath, so everything's going to shrink down. But if it doesn't sit just right in your clothes, if we sit with a little bend over, if we've got a belt that's too tight, which is common here in Texas, then you can get these little creases. If we skin coach and put the skin exactly where we want, then we control where it redrapes, where it sits, scars down, and that takes some of the guesswork out. And really, it's these little things that make big differences.
So, sort of like a corset for the butt.
Uh, a little bit, except we're stretching it out into position so everything redrapes nice and smooth.
Gotcha. Oh, fascinating. Okay. Fat transfer for the butt and breast can give patients this natural result with no implants, but it only works if there's enough fat to harvest, correct?
Correct. And been one of the biggest challenges with so many people on their GLP, weight loss, Ozempic, Zepbound, all these type of medications.
Okay, 1 to 10. How often do you see patients who want that hourglass result, but simply they just don't have enough fat to make it happen these days?
Probably 6.5.
Really?
Mm-hmm.
Okay. So, if a patient is considering a BBL or fat transfer to the breast, what questions should a surgeon ask the patient before committing to perform the procedure?
Yeah, definitely want to make sure that patient's weight is stable. Because if we're doing any lipo fat transfer, because remember, it's still your fat. So if you gain weight after this, your butt or breast can get bigger, which may be good, may not be. But we want to make sure that you understand what you're getting into. So I think people's weight being stable is super important, especially in these days of some of the GLP medications, where we definitely have seen some fluctuations. I also think it's important for people to realize that just because you've had lipo doesn't mean that you can't put weight on. And you've recreated this distribution. This is why I love doing fat transfer anytime we do liposuction, is that we can control where you're going to put weight in the future. If you just take fat out and you gain weight, whatever fat cells you still have are going to get bigger. So now those areas we didn't lipo, such as your arms, maybe your calves, maybe your thighs, could get bigger if you gain weight. or even worse, visceral fat, so that internal fat. So if you've ever seen anybody, have almost like a pregnant belly, you've got a lot of fat inside under those muscles. And this is why you've got to be really careful about people being stable with their weight or controlling where that fat's going to go if they did gain some weight.
Okay, yes. I've talked to Dr. Yovino and he's doing a lot of
Hmm.
BRs, Brazilian butt reversals now
Hmm.
because the fat, just over the years, they've gained weight and the fat's gotten bigger. Do you actually get more fat or does it just increase in size?
The fat cells themselves increase in size.
Okay, great.
You're
Okay.
born with a set number of fat cells, and unless you get some type of transfer, which there's some things coming, so hopefully you'll have me back in a couple of years. There's some really cool things coming in the pipeline. But for now, whatever fat cells you're born with, that's what you have. Those cells just get bigger and smaller when you gain and lose weight.
Okay, great.
That'll probably change in about 3 years, but yeah.
Uh, I was going to ask you more about future, and I thought, gosh, we've got enough to talk about with just here's today. Okay, Dr. Franco, you just told us that fat transfer can give patients a fuller figure, bigger booty, fuller breasts without a single implant. And that the procedure that once had the highest death rate in cosmetic surgery is now one of the safest when done correctly. And that's a story I think every patient deserves to hear. Thank you.
Thanks so much for having me.
Beauty seekers, here's what we just learned from Dr. Franco. Back in the day, BBL was dangerous because fat was being injected into the muscle, where it could enter the bloodstream and travel to the heart. 90% of early fatalities happened in one geographic area. And today, ultrasound guidance is changing everything. Fat only goes into the fat layer now by a skilled practitioner. And the demand for fat transfer is not faded, it has evolved. Today, Ozempic patients are seeking not to get bigger necessarily, but to restore the parts of their body where a bit too much fat was lost. Before we get into what is changing in the world of fat transfer to get a more hourglass shape, could you tell me about someone that you had to turn away back in the day, someone who wanted a BBL or a breast enhancement through fat transfer, and you simply couldn't help them because they didn't have enough fat? What did that conversation look like?
I'll tell you that that conversation has happened so many times in the past. And it's not that we didn't do anything. There was other options that we used to use, such as biostimulants, maybe some targeted HA, maybe some other things. And the problem is a lot of those results were very expensive. They had mixed results. They had limited enhancements. So, it was always challenging to offer something that didn't maybe give patients the results that they loved or hoped or wanted. So those things were a little bit challenging. I think now that we can offer somebody that I feel really great about, people have had great results with, that's super exciting.
Dr. Franco has performed thousands of fat transfer procedures, BBL, breast enhancement, body contouring, and has seen firsthand how many patients fall through the gap. They want hourglass results. They don't want implants. And sadly, they don't have enough fat to transfer. Although there were other options, it's nothing like what's coming on the market today. He's now working with a company that is solving that exact problem. And he's one of the first surgeons in the country doing it. Coming up, he's going to tell us what that solution is and who it's actually for. Dr. Franco, some call this new procedure the zombie butt, fat in a can, or just body filler. On a scale of 1 to 10, how accurate are these names for describing what it actually is?
Gosh, probably like a 9. So I mean, I would say pretty good. This new product, alloClae, it's a processed donor fat, so it does come from cadaverous people who designated their body, honestly, for aesthetic procedures. But what's really unique about it is it's 60% adipocyte cells, 40% extracellular matrix. We've never had an off the shelf product designed specifically for the body. And if you think about it, now that we have something that was designed specifically for the body, it enhances the type of things that we're looking for, especially when we're talking about the butt and hips. We've never had a large volume filler. We've never had something with this kind of strength to be able to sculpt and shape. And I think that's why the results have been so exciting for so many patients.
And traditional fillers, they last months. Fat transfer results are largely permanent once the fat survives.
Mhm.
1 to 10, how long does alloClae last?
A great question. I can't say that we 100% know, but I would say probably it's going to end up being like an 8.9. I was fortunate enough to be part of a clinical trial. What's super exciting about that is that we actually looked at the longevity of alloClae. They did 5 sites around the country, world-class plastic surgeons from all around the country. And we measured them at various time points. Actually, the 6 month data is just being released that showed almost 85% retention of alloClae at 6 months. And this is laser measured all the way around. And then the 12-month data, everyone's already been completed in the study. That results will be coming soon. I think that's going to be well over 80%. That's what we saw at our site. So, I mean, to be able to see this. And then what's more interesting is we actually looked at these patients at time points along this with the ultrasound that we talked about during the BBL segment. And what we saw after about 4 months is that you saw that the product started to integrate. And so you at the beginning, you could see that alloClae product. Over time, the result was stable, but you couldn't see any more of the alloClae product anymore. It looked like your own fat. So the concept behind alloClae is that you've got this scaffold with this extracellular matrix that's causing stimulatory effects of your fat to integrate. So now you are causing, this ingrowth, and the goal is to create your own fat scaffold that's going to give you a natural result that's going to last for years and years to come.
Wow. I looked on the website before having the interview here, and it mentioned something about the importance of this honeycomb effect. Is that sort of what you're talking about, the scaffolding?
Exactly. So that's the adipocyte cells that cause this honeycomb or scaffolding. And that's what gives you that lift and strength. That's what holds the shape while your body integrates throughout that scaffold.
Hip dips, liposuction irregularities, area where the surgery left something uneven. I imagine these are patients who need a small targeted correction, not a full BBL or breast lift procedure. 1 to 10, how useful is alloClae for these smaller kinds of corrections?
Oh, 10. I mean, I think for small hip dips, lipo contour deformities for these small areas, absolutely incredible. I think you're going to see an expansion into full BBLs, full breast augmentations over the future. No question, there's a price still associated with alloClae. It's a newer product. I think as that continues to decrease, which the company has done, I think you're going to see it become more and more widely available and then be able to use for these other treatments.
Okay. I love that. I love talking about the future. And can we just step back a little bit, because I did some research and I found when surgeons were speaking about this being donor fat, I don't think that there was clarity that this is donor from cadavers. So a lot of the beauty seekers were saying, "I'll donate."
Mm-hmm.
So can you tell us a little bit about the process, if you have any kind of level of detail there, that how do they?
Yeah, so there is a screening process that goes. They have to meet a certain criteria. The fat is taken from abdomens of these people who have donated their bodies, and so they can take that fat, and then it goes through a processing which removes any of the nuclei, any of the cells that you would have a reaction to, and then you've got just those adipocyte cells, that extracellular matrix that gets processed, because then it's made into a nice fine material that looks just like your own fat, right? Because it's those adipocyte cells, that extracellular matrix. Extracellular matrix is basically all the stimulatory effects, all the things that signal the skin rejuvenation, the stimulatory effects of these fat cells mixed into it, and that's what creates this really nice product that you can use for an enhancement.
Okay. I was talking to Dr. Sterry about facelifts and so forth the other day, and a little bit of fat transfer, and we got on alloClae a little bit, and he said it was kind of scary at first, but then when he dug in, procedures have been being performed with cadaver materials for years, right? So this is not really anything that should be scary or considered that new, although fat is new, but like bones or cartilage. Is that true?
100%, it's true, and so we've used it for all sorts of things, for ribs, for other things, and because remember, when we try to do plastic surgery or even any type of orthopedic or other type of surgeries, we need these materials to help people heal, to reconstruct, to build and create that. So it's not a novel process. I think what's novel is the way they've been able to take these adipocyte cells, these fat cells, into a way that's caused this longevity, this shaping, sculpting. So that's what's unique.
Beauty seekers, here's what you just learned. If you want fat transfer to fill lost fat or enhance your hourglass shape, and you do not have enough of your own fat, there is now a solution. If you want fuller breasts without implants and do not have the fat to make it happen, there is now a solution. And if you've lost weight on Ozempic and feel like your curves went away with it, there is now a solution for that too. Dr. Franco, how available is this technology across the United States?
Honestly, it's become widely available. If you look at it, we're hosting trainings all the time. I know that some of the other centers are. So most likely, you can find a board certified plastic surgeon in a town near you that offers alloClae. So probably 2 years ago that was not true, but it's become very, very available now. So making sure though that you talk to somebody. I think the biggest thing is making sure you have realistic expectations. There's still, especially when we're talking about butt and hip tips, there's still a certain amount of product that's needed for that transformation. So I think that making sure that you're both super clear about where you're trying to get to.
Okay. And in terms of being really clear, let's be really clear. This is for a board certified plastic surgeon to be doing these injections, not necessarily an RN or an injectionist.
When we're speaking only about butt, there are some nurse practitioners, PAs that have gone through training that can do some of this. If we're talking about alloClae in the breast or some other areas, then should be done by a board certified plastic surgeon.
Gotcha. And they should be using an ultrasound device, correct? Or
for the most part, depends where you're at. I think in the buttock area, I personally think it's safer to use an ultrasound in most cases. I do think if you're talking about other places like lipocondylar deformities, legs, abdomen, I don't know that you need an ultrasound for those areas. But when we're talking about buttock projection, those type of things, I think you still need a good level of caution.
okay, great. Thank you so much. You took us on a journey today. It started with the waist, where so many patients have been told their shape it's just their shape, and it's not. Rib remodeling can change that the same day with a procedure most people never knew existed. And then it moved on how to enhance that hourglass shape achieved by rib remodeling. Fat transfer can build the booty and enhance the breasts without implants using fat from your own body. And then you showed us what happens when the body does not have enough fat to give, and that for the first time, there's an answer for those patients too. You are a gift to every beauty seeker who thought they had run out of options to achieve an hourglass figure. Thank you.
I love this. alloClae is giving people options where they never had one. So that is super exciting.
It is exciting. And thank you for participating in that study. I mean, we need the surgeons to partner with the technology.
And there's more coming. We're actually doing a histology study where we're going to biopsy some people that have had alloClae about a year ago and look at the transformation. So, what we believe on these imaging, but now we'll actually have the real tissue to analyze and look at.
What is there a theory behind that? Like, we hope to see this, or you're just going to go
I
in
hope to see, because we're going to do some from kind of just normal tissue. The hope is that they look exactly the same.
Sweet.
I think over a period of time, you'll see some inflammatory effects. I think the further out, like we have someone who's almost 2 years out, the hope is that person, you won't see any of that. And, someone at a few months, you'd kind of see this gradient.
Exactly. Yeah. So it's the longevity of retaining the fat is so important.
Mhm.
Then also what happens to it? How does it grow? Where does it go?
Yeah, exactly.
Beauty seekers, thank you. If you have not subscribed yet, please do. Every subscriber is how we keep bringing you surgeons like Dr. Franco, who is working with cutting edge technologies like rib remodeling, fat transfer, and alloClae. And thank you for being part of our community that believes you deserve to know what is actually possible aesthetically before anyone tells you no. Sarah, you train other providers on cellulite all over the country.
Have the cellulite. So no matter how much you squat, how much you work out, like you mentioned, I've got super fit women that still have cellulite. If we don't get rid of those bands, then we'll always have the dimples. Yes, long lasting treatment. That's kind of the best way I can describe it. And that's a little hook release, and then everything can be nice and smooth.